Welcome back to the Deep Dive. So if you've stepped foot into any grocery store, any pharmacy, or even just scrolled through a wellness website lately, you know what we're talking about?
Oh, yeah.
The world of dietary supplements is just, it's vast, it can be really confusing, and it's absolutely unavoidable.
It really is.
We're talking about this multi-billion-dollar industry that's a mix of, health hopes, real science, some very aggressive marketing, and a regulatory structure that is, well, it's unique.
It's the Wild West of wellness in
Yeah.
a lot of ways. And because these products are so integrated into our daily lives, we kind of treat them with the same trust we give to, say, pharmaceuticals.
Right.
But the trust, it's often misplaced when you look at how they're actually regulated.
And that's the core of our deep dive today.
Yeah.
Our mission really is to give you a shortcut to being well-informed. We're going to unpack how these products are classified.
Yep.
We're going to dissect the cornerstone legislation, DSHEA, that defines this entire industry.
A very important piece.
And most importantly, we're giving you the tools to read a label and understand what the claims really mean and which ones to be a little skeptical of.
Okay, so let's start with the basics. We need a solid definition. A dietary supplement is essentially a product that's intended to add nutritional value to your diet.
To add to it.
Exactly. They're taken by mouth. They come in forms like capsules, tablets, liquids, powders, and crucially, they are meant to supplement, not replace, a healthy diet.
Okay, and when we talk about that huge variety on the shelves, we're mostly dealing with, what, 4 main categories that you're going to see over and over again?
Precisely. The first and the most familiar one would be vitamins and minerals.
Okay.
These are your essential micronutrients. Think of them as the little helpers the body absolutely needs for thousands of processes. Vitamin D for calcium absorption, B vitamins for energy metabolism.
These are the ones we sort of inherently get. But the next category, this is where it gets more complex, right? The herbal supplements.
Yes. Herbal supplements are derived from plants. So you're thinking of things like ginkgo biloba, St. John's wort, turmeric.
Things with a long history.
A very long history of traditional use, but their potency and their effectiveness can be incredibly variable.
How so?
Well, because they're whole plant extracts, the chemical makeup can change drastically depending on where the plant was grown, how it was harvested, how it was processed. That variability is a huge complication.
Got it. Then you have the building blocks.
Mm-hmm.
The ones you see marketed to athletes a lot.
Right, you're talking about amino acids. They're the precursors for making protein. So essential for muscle repair, making hormones, even brain function.
And enzymes.
And enzymes, yeah. Those are the biological catalysts, the tiny workers that speed up all the chemical reactions in your body, from digestion to, creating energy in your cells.
Okay, so we've got the ingredients down now.
Mm-hmm.
The elephant in the supplement aisle.
Mm-hmm.
Regulation.
Mm-hmm.
You hear all the time that the FDA doesn't regulate these things, but that's not quite right, is it? It's more complicated.
It is much more complicated.
The real question is, who is checking that these are safe before they get to the store?
That is the single most critical distinction you need to understand. For a pharmaceutical drug, it has to go through years of rigorous clinical trials to prove it's safe and effective.
And the FDA has to sign off.
The FDA has to approve it before one pill is sold. For dietary supplements, that pre-market approval just doesn't exist.
So if the government isn't checking them beforehand, the responsibility lands squarely on the manufacturer. That's a huge difference.
It is a staggering difference. The manufacturer is responsible for making sure their own product is safe and that the label is accurate. It's only if the FDA gets information that a product might be unsafe after it's on the market.
After people are already taking it.
Yes. Then they can step in, demand proof, and maybe issue a recall. It's a reactive system, a post-market system, not a preventative one.
And this whole structure, this entire industry, is basically defined by one very controversial piece of legislation. The Dietary Supplement Health and Education Act, DSHEA.
DSHEA from 1994. That act is the reason the supplement aisle looks the way it does. Before 94, the FDA was actually trying to regulate high-dose supplements as drugs.
Which would have been a very different world.
It would have put a lot of these companies out of business.
So DSHEA wasn't really a consumer safety law, first and foremost.
Okay.
It sounds more like a political and economic move.
Exactly. The industry put on a huge amount of political pressure. They argued that consumers should have access to these products without all the expensive red tape of drug regulation. DSHEA was the compromise.
And what did it do, practically speaking?
It legally defined what a supplement is, setting it apart from food and drugs, and it created that much lower bar for regulation.
So what does that mean for a new ingredient? If a company wants to launch something new, what does DSHEA make them do?
Okay, so if a manufacturer wants to use a new dietary ingredient, basically anything not sold in the U.S. before October 1994, they're supposed to notify the FDA 75 days before they start selling it.
Notify, not get approval from.
A crucial distinction. They have to provide some evidence that it's reasonably expected to be safe. But what counts as good evidence is complex, and there are loopholes. The FDA is only informed they don't have to give a stamp of approval.
Wow. So you might see a new product and assume it's been vetted, but really, the FDA might have just gotten a memo about it.
That's a good way to put it, and that leads us right to the labels, because the label is pretty much the only official communication you have about what you're actually putting in your body.
Absolutely.
Yeah.
And when you pick up a bottle, it can feel like reading another language.
Sure.
What are the non-negotiables? What has to be on there?
Okay, the basics first. Name of the product, serving size, servings per container, and the manufacturer's address. But the most important part is the supplement facts panel.
Looks just like the nutrition facts on food, but what am I really looking for there?
It must list the name and the quantity of every single dietary ingredient. For a standard vitamin, it'll often show the percent daily value, the percent DVs. That part's straightforward. But it gets really confusing when manufacturers use something called a proprietary blend.
Ah, the dreaded proprietary blend. I see that everywhere. Why should that make me pause?
Because it's a transparency killer. With a proprietary blend, the manufacturer only has to list the total weight of the blend, not how much of each ingredient is in the blend.
So you have no idea of the dose?
None. They list the ingredients in order by weight, but you'll never know if you're getting, say, 99% of a cheap filler and only 1% of the expensive active ingredient you actually want.
They say it's to protect their secret formula.
That's the argument, but it leaves the consumer completely in the dark.
Okay, that's a huge insight. But what about the claims on the front of the bottle?
Yeah.
The marketing stuff, they can't just say whatever they want, right?
No, they're walking a very fine regulatory line. They can't say, this cures heart disease, but they can say things that sound pretty close. There are 3 main types of claims they can make.
And the most common one is?
The most common and often the most misleading is the structure function claim.
Okay, so what's the exact difference between an illegal disease claim and a legal but maybe fuzzy structure function claim?
An illegal claim is one that says the product can diagnose, cure, mitigate, treat, or prevent a specific disease. For example, lowers high blood pressure or cures arthritis. That's drug territory.
Right.
A legal structure function claim, however, just describes the role of a nutrient in supporting the normal structure or function of the body.
So instead of cures arthritis, they would say?
They'd say it supports healthy joint mobility or promotes joint flexibility.
Ah, I see. It's a subtle but critical difference.
It is. They're talking about a normal body function, not treating a named disease. That's why you see words like supports, promotes, and maintains on almost every single bottle.
So if these claims aren't backed by the same evidence as a drug, how do we know they're not just, marketing fluff?
You don't, really. Not without looking for the required disclaimer.
There's a disclaimer.
Every single structure function claim must be accompanied by this sentence. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
So they have to tell you the FDA hasn't checked their work.
Exactly. That disclaimer is the manufacturer's legal shield, and it's your ultimate warning sign as a consumer. It tells you, flat out, the FDA has not reviewed or approved that claim.
That is the single most important takeaway. Always look for that asterisk. Now, despite this whole buyer beware system, the market is enormous. What's motivating people to use these products so much?
Well, the motivation usually comes from 2 places, necessity and aspiration. First, there's the real necessity of filling nutritional gaps.
Right.
In our modern lives, eating a perfectly balanced, nutrient-dense diet every single day is, well, it's hard, so people use a multivitamin as a kind of nutritional insurance.
Hedging their bets against a bad week of eating.
Exactly. Then there's the aspirations side supporting specific health goals. Building muscle with amino acids, trying to sleep better, boosting energy. People are looking for an edge.
But that search for an edge is where the risks can start to pile up, especially because of this regulatory system we've been talking about. Let's get into the dangers.
Okay, the dangers are sort of threefold. First, and this is a big one, is interactions with medication.
How so?
Certain supplements, especially herbals like St. John's wort, can seriously interfere with prescription drugs. They can mess with how your body metabolizes them, making them either ineffective or, in some cases, toxic.
So you have to tell your doctor everything you're taking.
Everything. The second risk is honestly chilling because it gets right to that lack of pre-market testing, unlisted ingredients.
You mean things in the pill that aren't on the label?
Precisely. It's a huge problem, especially in supplements for weight loss, sexual enhancement, and bodybuilding. We see recalls all the time for products that are found to contain hidden, active pharmaceutical ingredients, hidden drugs. It's incredibly dangerous, especially if you have an underlying health condition.
Okay, and the third risk isn't about contamination. It's just about taking too much, right?
Correct. The idea that more is always better is just wrong here. You have to think about water-soluble versus fat-soluble vitamins.
Okay.
Your body gets rid of extra water-soluble vitamins like C and B vitamins, but fat-soluble ones, A, D, E, and K, they get stored in your body fat. Taking huge amounts can lead to buildup and serious toxicity over time.
So with all this variability in quality and potency, how can anyone who actually wants to take a supplement do it safely? How do you know the label matches what's in the bottle?
This is the most practical advice we can give. You have to look for third-party certification.
So you don't just trust the manufacturer's word for it.
You don't. You look for a seal from a reputable, independent testing organization. They act as a quality check.
Like who? What should people look for?
Look for seals from groups like the U.S. Pharmacopoeia, or USP, or NSF International. When a supplement has, say, a USP-verified mark, it means they've tested it.
And what have they tested for?
3 main things. 1, that the product actually contains the ingredients on the label at the strength it claims. 2, that it doesn't have harmful levels of contaminants. And 3, that it will actually break down and release into the body properly.
So it's not just what's in the pill, but can your body even use it?
Yes, that's called bioavailability. You could have a pill patched with an ingredient, but if your body can't absorb it, the dose is effectively 0. Third-party testing helps verify that.
Okay, let's pull all this together. Supplements are this unique category legally defined by DSHEA.
Right. They operate under a reactive, post-market regulatory system. The manufacturer, not the FDA, is on the hook for safety before it's sold.
They offer real potential benefits, like filling nutritional gaps, but they come with serious risks, drug interactions, contamination.
And those risks are amplified by things like proprietary blends that hide the real dosage.
So the big takeaway here is that supplements should always complement a healthy diet and lifestyle. They're a tool, not a cure-all.
Exactly. Approach them with an informed skepticism. Understand that a marketing claim is not a medical fact.
And we'll leave you with one final thought to chew on.
Given that the FDA doesn't do pre-market approval, and given that third-party testing is completely voluntary...
Right. Companies don't have to do it.
They don't. So what does this reliance on a private, voluntary system tell you about the amount of homework and critical thinking that you, the consumer, now have to do just to make sure a product is safe?
It changes the whole dynamic. So keep researching, keep looking for those third-party seals, and keep questioning every single claim on that label.